I'm Jerry Mohan. I'm a retired nurse practitioner. I'm here in Uganda. I'm trying to help the medical team here. I'm a retired Navy veteran, 23 years. So I was a Navy nurse. I did everything, OR, ER. So I've been doing healthcare, since I was 19 years old. So.
Okay. But it's your first time in Uganda?
First time, yes, in Uganda. Today started, as the morning we got here, the cases started going. What I did is started circulating and, helping out wherever I could. Unfortunately, we had a crisis with one of the babies had to be resuscitated, so anesthesia got called, so I just took over just to, make sure that the patient was very stable. So that was one of the things I did. And honestly, I do anything that I think there is a need to do. It's very hard sometimes to figure out which residents are because there's no identifying. The first day yesterday when we were doing cases, Miriam there was she was acting as the surgical nurse, and I assumed she was a surgical nurse. And then all of a sudden, a couple of cases later, there she is as she's the resident. She's, I believe, a fourth year, fifth year resident, surgical. And there she is actually doing the surgery with, of course, one of the senior physicians guiding her, but actually doing quite well. And then Mark, who is our anesthesiologist, there he is, and you see him teaching the Ugandan anesthesia about spinal blocks and a few other things. So, after the second day, I'm beginning to see who is who, which residents are which. And the philosophy seems to be from Medlend, and that is they're training the residents, the Ugandan residents, and I'm totally blown away and impressed by them.
Okay. So fistula repair is quite a specialist skill.
It is, and sometimes these young women, you develop these tracts, and they literally come out into the urethra or somewhere into the vaginal tract. And these women are constantly leaking, and it smells, and they're ostracized. I mean, they are ostracized. It brings them back into, society again. I mean, how remarkable is that to do that? So, I'm just so impressed with that. I think it's given me a lot more than I've given here, because a lot of people can do what I'm doing, but to go back with this, it's pretty amazing.
Awesome. Jerry, thank you so much for the interview.
You're welcome. You're welcome.